How can we put communities at the heart of institutional architecture, especially if those communities, like Indigenous people across North America, have a difficult relationship with healthcare, education, and justice facilities? Parkin Architects, one of the leading healthcare design firms in Canada, is evolving with a renewed focus on what it calls social architecture. I sat down with Claire O'Donnell, Kyle Basilius, and Robin Snell to understand how Parkin operates today at the intersection of health, sustainability, and community. Claire, Robin, Kyle, it's such a pleasure to have you on with me today. Why don't you start by telling us about where Parkin finds itself at this juncture? What is the new face of Parkin? And 80 years into its journey, how is the firm evolving today?
To stay in business 80 years, it's essential for every firm to continue a journey of evolution. And the thing that's been core to our beliefs and our work is an idea of social architecture. We're very much focused on work that will have a positive impact on people's lives, work that is to the betterment of our community. And to that end, we've kept that as our core principle, our core focus in all of the projects that we've been involved in. We've been lucky enough to grow organically, expanded from what is a foundation of maybe majority healthcare projects into complementary, so what we believe are social architecture fields such as corrections, justice, areas of recreation, work that really does impact community.
Within that field of social architecture, what are some of the areas or approaches that you're focusing on? What approaches do you find really help you focus on communities and focus on people within all of these different typologies?
We're lucky that in Canada we've such a diverse community, and taking a focus on each individual, understanding how people occupy space, focusing on equity in how we design spaces, so understanding the needs of each users, understanding both the emotion and the design aspect that we're trying to bring to a project is a key driver for all of our work. So maintaining that equity, maintaining ideas of accessibility and inclusion are so important to how we implement our work and how we design our projects.
Perkin has such a great legacy in healthcare. It's one of the most well known names in Canada for healthcare design. Let's talk about that core typology. How would you say the healthcare practice is evolving? What are some of the new milestones in your healthcare practice?
It involves about four key aspects. One is the notion of a healing environment and creating an environment where patients and their family members can heal, convalesce, and recuperate. And that's a fascinating opportunity for us to help people do that. It happens in probably some of the most technologically complex building types we can possibly do, and there's a fascination with ever evolving and changing technologies for us to track and stay on top of. Essentially, what I'm trying to get at is the passion to work on these healthcare projects. It is addictive. Our people get into it, they get in deep, and they just want to do more and more of it. A big step for us was almost 18 or 20 years ago when there were two of the first private-public partnership type healthcare infrastructure project competitions being run concurrently at the same time. And Parkin was able to win both, essentially implementing both at the same time. And that was our springboard for sort of the large institutional projects. And since then, 18 to 20 years, we've been specialists in the P3 type healthcare sector projects. And then more recently, the procurement models are changing. So there's a new progressive, it's called DBFM model in Ontario. In British Columbia, there are new alliance models. These are ways to implement some of the larger or more complex, even mega project types. So as far as sort of us adapting with the times, moving with the times, that I'd say is one of the key milestones and transitions we've been making in our current projects.
It's so fantastic. I mean, your passion for healthcare and what you call bench strength, that deep expertise and rigor that you have, really enable you to take on some of these mega projects and to adapt to some of the changes in the healthcare industry. Of course, talking about sustainability and health and well-being. I believe you're up for one of the first well building certifications for a healthcare facility. How is Parkin putting a focus on health and well being within healthcare, but also across other building types?
An evolution in healthcare, I would say, is that about 15 to 20 years ago, there's a notion of using evidence-based design, a little bit more rigorous approach to understand the elements within design that will make the patient care experience and the outcomes for the patient better or improved. And that's been an evolving market. Um, Soon after that, there was a realization that making the environment healthy for staff to better support the patient and the family, to attract and retain staff and create the best staff they could possibly do for their facilities became a further impetus. So to your point, the wellness, the well certification process, essentially that's largely involved around improving the environment for staff and outcomes for staff. And so steadily over the last 15 years or so, we've been working hard to sort of track the quality of the environment for staff in addition to the patients concurrently. So things like for staff, quality of daylight, access to views, access to nature, quality and proximity of lounge spaces, amenities, access to good food, access to outdoor space, amenity, etc. Also being able to enable and empower staff to be able to do their job more safely, more socially, uh, with the better tools essentially at their fingertips to be able to implement their work. Certainly, IT technologies are a huge component of this, and so we've had over years to try and evolve and develop and improve the environment for staff, etc.
We work on a lot of education projects up north, which is a very specialized environment, very unique typology, unique communities, and carrying those ideas through of equity that I mentioned earlier, the ideas of wellness. It unifies and ties together the core of our beliefs in design, but it also helps to better the design and the practice of design and how people are using those spaces.
We do a lot of mental health and psychiatric facilities across the country. I think Canada's at the forefront. I recently worked on a assessment of a psychiatric hospital that was designed more like a corrections facility. But the evidence, says that that's not the way to actually rehabilitate people and have them then be reintegrated into the community. And so I worked with the client to really just, how do we identify what those key pieces are that could be better to have a business case to the ministry to build a more healing environment? Because even the health authorities said that the building wasn't satisfactory to their level of care that they wanted to deliver to rehabilitate these patients. And that, having a mental health issue shouldn't be a life sentence.
Kyle, I wonder if you can talk to us a little bit about the work that Parkin is doing, as an expert in healthcare design with healthcare organizations around the world. I know you're part of the Initiate 2 project. Can you talk a little bit about that and how, as you've just mentioned, Parkin is taking its expertise kind of to the field, to communities in Canada and around the world?
One benefit Canada had was they were really affected by the SARS epidemic. And that really changed the way we designed our hospitals to combat and plan and to be able to handle infectious disease outbreaks within the hospital itself. But with COVID, it took disease outbreaks out of the hospital and into the community. So even in Canada, we worked with the health authorities to develop the mobile response COVID unit, which was able to be deployed in urban areas or remote areas to go to the community and tackle the first outbreaks of infectious disease. And I think back to what Robin was saying about what we've learned from evidence-based design in the facilities we're doing now, which is now standard practice, is that so much about patient care and recovery come from the community and the family and the staff being a part of that recovery process.
I also know you've been doing a lot of work with Indigenous communities in Canada, especially as part of your education practice, but also as part of other project typologies. Can you explain Parkin's approach to stakeholder engagement, both on those projects that center Indigenous communities and other projects as well?
Reconciliation is very important right now in Canada to rectify the wrongs we've done in the health industry and amongst the residential school past history. At Parkin, we're committed to learning about all First Peoples, First Nations, Métis, and Inuit. And we do community centers up there, education facilities, and health centers. And we humbly and respectfully approach engagement with the local nations be it on our healthcare projects or our northern schools. We have provided fulsome education to all staff through the SANYA's Indigenous Cultural Safety Training. And at Parkin, we believe rights holders should always lead the conversation about their community's specific needs, and that we are humbly students and there to listen and learn. And then what we learn from there, we strive to design architecture that is inclusive and culturally safe for all, but also for those who come from communities which have historically been turned away from the healthcare system. It is important that they see the building reflects their communities and they feel a part of it. So that's kind of the end result of this fulsome engagement, is to have them feel safe and make the space familiar for them so they're not afraid to come when they're sick to get healthcare. We're working on a great hospital, the Cowichan District Redevelopment Project in Duncan, BC. It's home to the Cowichan peoples, and has the most nations and tribes in all of Canada and the most languages spoken. And this facility really was seen by the provincial government and the Island Health Authority and the design team as a big part of reconciliation going forward for the community. We oriented the building, the design, to Mount Swuckus, which is like the origin story of the Cowichan peoples. And we called it the reach out concept. So we have like an all timber frame reach out building that contains the Indigenous program with the gathering space and healing gardens. We have medicinal gardens to provide natural plant medicines to the traditional ways they would treat themselves. We have an Indigenous food kitchen as part of food service, so they can prepare their traditional foods the way they want to prepare them and then serve them to the patients. And also there was a requirement for traditional burning only for one space, the gathering space in Indigenous. But with the design team, we were able to push that to 189 rooms now. So all inpatient local peoples are able to do their traditional burning ceremonies as they see fit in their spaces with their families. And so we've seen that as a big win. And we're just, we're constantly learning all the time, but we're doing some cool things out there.
So it's clear that Parkin, growing from its core in healthcare practice, but then expanding into other institutional sectors, has been really developing deep expertise, processes, as well as ways of gauging impact on many different fronts when it comes to, putting communities at the heart of architecture, practicing what you call social architecture. Can you summarize for me what you think Parkin's strengths are at this very complicated intersection of health and well-being, sustainability, and community, both in healthcare projects and in some of the other projects that you tackle?
An example of that is a project on the west coast of Newfoundland in Corner Brook, which, through a combination of a huge geothermal field and hydroelectric power, will be the first zero emissions hospital in Canada. There are constantly a range of synergies between health and sustainability and contradictions between health and sustainability. I think our in-depth, sort of multi-year knowledge of detailed healthcare planning and design gives us the background, and then we're happy to collaborate and work with specialists in emerging fields, things like embedded carbon or new emissions, improvements in technology to improve energy, so that we can then leverage and use our skills, expertise, plus our curiosity and our willingness to collaborate, to really sort of work to be at the forefront to try and develop and strike the right balance of these synergies.
I think another unique thing that we do that has been a big part of our success, and this builds on the people part that Claire mentioned at the beginning. We don't, even though we have a lot of experience, when we do social architecture as problem solvers and architects and designers, we have to humbly go in and listen to how they want to work or use the space. We can't come in as the expert and say, I know best, because every building and every community has a different culture, and we need to know how they're going to work, how they're going to operate, how do they want to use the facility, and then we can find the best solutions to make that a realization. So it's a lot about that user process of those meetings and iterative design process of working together with the people that will use the building, the community members, the patients, the staff, and the people who will run the hospital to find like perfect solutions.